So we conducted a large-scale meta-analysis of randomized trials comparing coronary elective revascularization versus medical therapy alone in stable patients with documented coronary artery disease. The findings are really important, significant, and robust in showing a cardiac mortality reduction with the revascularization plus medical therapy versus medical therapy alone. This significant cardiac mortality reduction persisted in all sensitivity analyses conducted. Moreover, similarly, we found a significant reduction of spontaneous myocardial infarctions that were related to cardiac mortality. And remarkably, there was a linear association between cardiac mortality reduction and the length of follow-up. So the magnitude of cardiac mortality reduction is a function of revascularization and duration of follow-up, with increasing follow-up portending higher reduction of cardiac mortality with the revascularization. These findings have important implications for the management of patients with coronary artery disease. Exactly as you said, it's important to point out that is the synergism between revascularization and medical therapy means combining these therapies versus medical therapy alone can provide long-standing benefits over time and accruing over time, meaning that for each 4-year follow-up, it's possible to predict a 19% reduction of cardiac mortality. Therefore, we should not wait to treat patients in order to allow accruing a benefit of treatment over time. It's very important to say therefore that the benefits are incremental with the time. Thank you for the question. So all trials comparing revascularization versus medical therapy alone were underpowered to draw conclusions on cardiac mortality. In contrast, this large-scale meta-analysis, as shown also by a trial sequential analysis, is very robust and definitive in showing this benefit. With regard to the ischemia trial, the large trial, recent trial, which was negative for cardiac mortality for the primary endpoint at a median follow-up of 3.2 years. However, at 5 years follow-up, there were fewer cumulative cardiovascular deaths in favor of revascularization, but the trial could not demonstrate a significant benefit because it was underpowered. This analysis conducted, including studies at the longest available follow-up, allows to show a very robust and sound reduction of cardiac mortality, which has implications because based on these findings, it is unethical not to treat the patients, not to offer revascularization to stable patients with the coronary artery disease. So far, the current guidelines recommendation were based mainly on previous studies, as mentioned, the single studies or analysis that were underpowered. And the recommendation were mainly based on the possibility to improve angina symptoms in patients with coronary artery disease. However, based on this new analysis conducted right now, revascularization can offer a solid and robust reduction of mortality and increase the chance of surviving. So it is expected that an update of this recommendation should therefore account for these new findings. I mean, Yang, can you imagine that if we don't treat these patients, there could be thousands of deaths per year per each country. So based on this analysis, we could predict thousands of deaths. And this is something that you see also in the COVID area, because many patients treated at home are developing spontaneous myocardial infarction that can lead to increased mortality. So that's why mortality can jump just because you don't treat patients at hospital with revascularization.